Hello everyone, from myself, Dr. Rob Tomlinson, Clinical Director. It falls to me to draw today's partnership event to a close and to reflect again how well this day represents the successful service we have in MHSOP, built around the strengths of you, its workforce. Thank you to all of you for attending today. Although events of the last 18 months have meant that we've not had the opportunity to meet in large groups and socialise in the way that we're used to, it's wonderful that technology provides us with a chance to continue to connect with each other when times are difficult. The themes of today have been wide and reflect the sheer amount of work we do on a daily basis, providing direct care, developing future services and promoting the issues that matter to our patients, carers and staff. In MHSOP, our staff are engaged and active in promoting equality and challenging inequality when we're called to respond, and the work promoted in Black History Month and Pride illustrated this well. I've also watched with admiration the video montage that illustrated your strengths and achievements. We work in multiple diverse environments and provide a huge variety of specialist skills and input, and together this amounts to the provision of a complex service that remains patient and carer focused, offering support in times of need to some of our community's most vulnerable people. We heard Dr. David Connolly talk today about the Clinical Effectiveness Group, and I would urge that any of you that are interested to attend this forum, which gives us a chance to have our voice heard in relation to the clinical matters we care about. Every voice of every member of staff matters, and forums like this give us the opportunity to make sure no voice goes unheard. It was good news to hear that plans have been approved to implement safer staffing on our wards, and I hope that this serves to make our work less challenging, allowing us to provide the high standard of care we all strive for every day. This summary wouldn't be complete without some acknowledgement of the challenges we've had over the last year and the months preceding last year, given the extraordinary circumstances that have impacted the world in the context of COVID-19. You have worked to provide services to the most vulnerable people in these extraordinary times, and despite the challenges this has presented to you individually and in your teams, you have continued to develop and staff our COVID ward for some of our most sick patients in the time of their greatest need, in a context of uncertainty and fear. In inpatient services, you have continued to manage high levels of distress and keep our patients safe in times that have been anything but safe. In community services, you have altered practice and devised imaginative ways of working to keep the provision of high quality care despite the barriers imposed by distance working practices. Our admin teams have always been the linchpin of our services, ensuring that we remain cohesive and organised in a time when we might all have fallen to the challenges of enforced separation. Our domestic and ancillary staff have worked as never before to promote safe environments so that we can be assured that we're safe to come to work. You have had to manage your work in constant flux with additional family challenges of your own, worries about your loved one's health, and of course you've experienced deeply felt loss, and we will all continue to feel and reflect on these losses as we move forwards towards recovery. On reflecting on these challenges, it is my wish that the time has now come that we can begin to move forward with hope. Although we still have a challenging winter ahead, our NHS has proved its enormous strength in providing one of the most successful mass vaccination programmes in the world, ensuring our more vulnerable MHSOP patients and ourselves as frontline clinical workers are protected in the best way possible. Of course, I would urge you all to access COVID and flu vaccines and booster vaccines if you haven't already, so that we can continue to protect our patients, our communities, our loved ones and ourselves. I would like to take these final moments reflecting on the year forwards and some of the work and developments on the MHSOP horizon. I look forward to the development of the Therapeutic Intervention Service, and I'm excited to watch this unfold. Investment into memory assessment services means that we can continue to bolster our existing provision and continue the success of significantly reduced waiting lists. I also look forward to the development of new roles within our service and the innovation and change that this will bring. I'm excited about the development of TNAs, ACPs, physician associates, non-medical responsible clinicians and so forth, and the opportunities that this will bring for career progression and our workforce retention, as well as our primary focus of continuing to advance high quality care. I'm excited about opportunities to further develop our partnerships, both within the Trust as we work increasingly in multidisciplinary teams and as we build improved relations with primary and secondary care. It is my wish that we share this sense of hope as we continue towards recovery, and our resilience allows us to continue to be the caring and compassionate professionals our patients, colleagues and our health service needs us to be. It remains now for me to wish you all a peaceful and joyful new year, whether you're working or spending time with loved ones. I hope you all have the opportunity to spend some time resting and attending to your own well-being, and I look forward to working with you in the coming year. My heartfelt thanks to you all.